So for starters, you don't have to be menopausal to need hormones. So between your 20s to your 40s, 50% of your testosterone level in a woman will drop. That's significant. So with that may come a lowering in your sex drive. You may have a difficult time with word recall. You may not sleep as well. You may have some night sweats at night. Some of these symptoms you may actually notice when you go on birth control pills, because lo and behold, they lower your testosterone levels, which is sometimes a young woman will say, I have no sex drive when I'm on the pill. I'm having some night sweats. I just don't feel like myself. Well, a lot of that is because of the lowering of testosterone. Most people don't know this, that there's more receptors in the human body for testosterone than there are estrogen. So it is a very important female hormone. BioTE gives us that way to provide testosterone again safely. As you're aging, oftentimes we'll need to add estrogen though. Not everybody's a candidate for estrogen, but they may still be a candidate for testosterone. So it's been a big part of our practice. We have the pleasure of taking care of a lot of cancer survivors, and it's one more tool to offer them when estrogen was denied. So we check your hormones, make sure there's no other reason for the way you're feeling. If you're tired, we want to make sure vitamin D and B12 levels are normal, your thyroid is normal, you're not anemic, liver and kidneys are working well. Once we've evaluated that and realized that all we can find is that your testosterone has dropped or your estrogen has dropped, then we arrange an appointment for pellet insertion. These pellets are the size of a grain of rice. So we anesthetize the fatty tissue on your hip, make a tiny incision, and then slide in the pellet. And then just ask that you not do too many strenuous activities for the next 3 days. And that's it. And then we repeat it in 3 to 5 months, depending on how quickly you metabolize the medication. With our testosterone therapy, we've been successful at being able to take a lot of women off their antidepressants and anxiolytic drugs and sleep aids. So a lot of times if we're able to optimize your hormones, we can hopefully stop some of the other medications, give you the energy to exercise. You'll start seeing the muscle build up in a few months after, as long as you're doing all the right things and taking care of yourself with exercise. So, and oftentimes you'll see the weight drop once we've got you back in balance.